The weird ideas and shoddy science behind free government crack pipes. And then it was such a backlash. The Biden administration tried to go out and pretend like there were no crack pipes in the in those kits. But before we get into that, go ahead and hit that like button. Subscribe if you're not already subscribing. Share this out so we can get this information out there. Also, check the link in the description. That's my link tree with all my social media links connected to it. Also, my Patreon where I talk about things where I can't talk about here on YouTube. Also, check out my merch. We got T-shirts, all made in house. We got Let's Go Brandon T-shirts. I will not comply T-shirts, all types of T-shirts. So check those out. All right, let's get into the news. The Biden administration last week was forced to vehemently deny it. Deny it will fund the distribution of crack pipes after the Washington Free Beacon's reporting uncovered plans for, quote, safe smoking kits, included in a $30 million harm reduction grant. The denial surprised not only administration officials who still seem unsure if they were ever going to distribute pipes, but also some advocates who claimed the administration was letting, quote, clickbait and, quote, racism drive policy. See how they flip it on you? A bigger question has been lost in the dispute over the administration's plan. Why did anyone think handing out government-funded crack pipes was a good idea in the first place? Why would HHS be funding safe smoking kits, which even if they don't contain stems, do include other paraphernalia that facilitate the use of crack, cocaine, meth, heroin, and other drugs? Such methods are just one example of harm reduction, an approach to drug policy that has attracted attention in some big blue cities. The unprecedented harm reduction grant program is one of several signs that federal policymakers are similarly interested. And I would add that there is absolutely no science behind this that shows that this actually works. It's absolutely no, this is not evidence-based at all. And they pretend that they go by evidence-based stuff, but there's no evidence supporting that this thing even worked. But amid a historic wave of drug overdose deaths, it's little surprise that policymakers are considering unorthodox ideas. But while some harm reduction ideas have merit, the label is often a cover for radical proposals backed by the shoddiest evidence on proposals that can do real harm. And we're seeing it already. In principle, harm reduction refers to practices that mitigate the harm of drug use without reducing use itself. Such approaches need not to be controversial. HHS's grant outline, for example, mentions funding disease testing kits to help people who use drugs be informed about their HIV or hepatitis C status and therefore hopefully reduce transmission. In the broader context of drug policy, harm reduction can operate alongside enforcement, treatment, and education to minimize the harms of illegal drugs. But the term can include policies pushed by more activist-minded harm reductionists who are concerned not just with particular policies, but with wholesale critique of their understanding of American drug policy. You see, this is not backed by any evidence. This is just activists. And these activists tend to view the drug war and drug criminalization as more harmful than the drug use. They argue that overdose deaths are driven by an unsafe supply of drugs, which is itself, they claim, a product of criminalization. Some, including Columbia University professor Carl Hart, insist that most drug use is not problematic and that most problematic use is a product of social stigma rather than the intrinsically dangerous characteristics of drugs. And me speaking as a therapist that work with people that abuse drugs and have issues with drugs, I will say that that statement is not true. It is the drugs. It's not the social stigma. It's not the social stigma. It's the drug that's ruining these people, that's ruining these families. And if you think that's not true, I would encourage you to go sit in on an AA meeting or in a meeting where you can talk, where you can see people talk about their stories that actually addicted to these narcotics, addicted to these drugs. Won't you go sit in on these meetings? Anyone can go sit in on these meetings and hear these stories, and then tell me if it's social stigma that's causing this, or the drug use itself that's causing these problematic issues. See, people like this don't know what they're talking about. They're in schools and professors and don't really, not in real world scenarios, talking to people that struggle with these drug use issues. And these are the main people that's coming up with these policies. The distribution of safe smoking kits, including glass stems, is typical of the harm reductionist approach. As the Drug Policy Alliance, a major harm reduction group, describes it, such policies are meant to meet people where they are at, and keep people free of diseases and alive so they have a chance of recovery and healing. The group claimed that distributing safe smoking kits is an evidence-based practice, rhetoric often deployed by harm reductionists to plant political opponents as anti-science. But it's not based in evidence. There is not too many studies that actually say that giving people clean drug kits actually work. In reality, the evidence on which safe smoking kits are based is paper thin. One common argument for crack pipe distribution is that it reduces hepatitis C and HIV infection among users by reducing pipe sharing and therefore hypothetical contact between drug users, cut lips. This was HHS stated justification for funding safe smoking kits, for example. But the evidence that pipe sharing is actually a disease risk is weak, relying on surveys of drug users that correlate sharing with infection while doing little to account for the confounding variables. And y'all know me, I talk about statistics all the times. I read these studies, I look at these studies, and when you look at confounding variables, that's basically meaning other variables that could be causing the infections. They're not looking at other things that could be causing these infections. They're just assuming that sharing sharing the same pipe, when you got a cut on your lip, you transferring it. This is assumptions. It's not based on really any other they're not looking at any other variables basically. But notably, the Centers for Disease Control and Prevention does not seem to accept the pipe spread theory, counting needle sharing as a risk factor for HIV and hepatitis C, but not pipe sharing. And that's basically what I'm saying. I've never heard of anyone sharing a pipe with someone and getting hepatitis C. But one study claims to find an effort of Vancouver's pipe distribution on users' self-reported health, but there appears to be no actual trend in the data. Some evidence suggests that pipe sharing persists even when pipes are distributed, possibly because sharing is done as a social activity as much as out of necessity. A better supported argument for distributing pipes is that users may switch from injecting to smoking, which can in turn reduce disease and other risks. The measure effects are not huge, though 1 year after a safe smoking program was rolled out in Ottawa, 56% of users reported injecting at the same rate, while only 29% said they had started smoking more. Further, it's hard to square their evidence with the harm reduction commitment to also distributing syringes, something HHS also fund. The standard argument against the distribution of drug paraphernalia and indeed many harm reduction interventions is moral hazard. The idea that if policy reduces the risk of a harmful practice, people will be more likely to engage in the practice. Even if pipe distribution reduces the average user risk of infection per use, for example, it might also lead them to smoke more, increasing the total number of infections overall. Harm reductionists often dismiss moral hazard as a non-issue, but it can show up in even seemingly benign policies. Studies have found that expanding needle exchange programs may lead to an increase in opioid deaths, and that laws which make it easier to access the overdose reversing drug naloxone in turn cause an increase in opioid-related ER visits and no reduction in opioid-related deaths. The latter study by economists Jennifer Dolak and Anita Mukherjee attract fierce criticism from harm reductionists when it debuted, criticism that was often more personal than evidence-based. The aforementioned examples do not mean, of course, that pipe distribution necessarily increased drug use or OD deaths, but the evidence is not there to say that distribution works either. That makes it alarming that states and localities have accepted it as standard practice, or that the Biden administration will fund safe smoking kits in whatever form without better research into these effects. Indeed, policymakers are increasingly accepting harm reductionist favorite policies absent evidence against the risk of moral hazard. Major U.S. cities have recently opened so-called safe consumption sites, facilities where people can consume drugs under the supervision of medical staff with access to overdose reversing medication. The evidence to support their efficacy is similarly weak. Some sites saw increases in deaths and drug use in their immediate vicinity. So, I mean, there's no evidence that this actually works at all. Nevertheless, the Biden administration of Justice indicated earlier this month that it was evaluating such sites as part of an overall approach to harm reduction and public safety. That would be a reversal of Trump's administration enforcement of the federal ban on drug consumption spaces, and another sign of sympathy for harm reduction from the White House. Such a policy shift would be uncharted territory, at least for the United States, with drug overdose deaths pushing 100,000 a year. The experiment might be worth it, but it will more than likely cost more lives than it saves, a risk to which progressive leaders seem plainly blind. But let me know what you think about all this. Leave your comments down below. Like, share, and subscribe. And check out democrapublics.com for the latest in news. Until next time, peace.